Good afternoon, everyone. Welcome to today's School Nurse Professional Development webinar. This is a series of webinars that presents short educational topics of interest to school nurses across the country. So during today's session, we'll be discussing the SNAP Health Portal for parents above and beyond. I think we're all well aware of how important communication is to whole child healthcare. It's this sharing of information between parents and the school that really paints that complete picture of student health. And especially during this health crisis, while parents and school administrators are relying more than ever before on you as the school nurse, it is really important to have a good system in place. So with that, my name is Tammy Lariviere, and I'll be the moderator for today's session. But before we begin, I'm just going to take a minute for a little bit of housekeeping. So at the end of today's session, we should have a couple minutes for questions. So if you do have a question, you can type it into that question area of the GoToWebinar control panel on the lower right-hand side of your screen. We'll try to answer as many questions as we can before the end of our time here today. So please don't be shy, ask away. So now I'd like to introduce our speaker. Today is Bill O'Malley. Bill has been with PSNI as a strategic account executive for coming up on 3 years now. Bill works very closely with school nurses to help with software solutions in the health clinic. He's also spoken on EHR best practices for documentation using SNAP Health Center at school nurse conferences around the country. So with that, I think we can get started. If you're ready, Bill, I'll hand things over to you.
Thank you so much, Tammy. And hello, thank you all for joining us today. As Tammy mentioned, my name is Bill O'Malley, and I'm a strategic account executive here at Professional Software for Nurses. That's PSNI, the makers of SNAP Health Center, and other add-on options like the Health Portal, which we'll be discussing today. Over the last 20 years, I've worked in the public sector as well as technology, physician, and software sales. And I definitely try and pull in everything I can from those experiences to help the school nurses I have the honor of working with now meet their documentation needs and hopefully gain the most useful insight into the health of their students through SNAP Health Center and add-ons like the Health Portal. Even before the COVID-19 crisis began, I observed that school nursing is a uniquely challenging role with demanding medical documentation requirements, complicated in some ways by the expectations of the world of education. If you're attending this webinar, you probably already knew that, but it's still worth saying. I know how busy you all are, so this webinar should take approximately 20 minutes with some time for questions. That said, I'll review the comments after the webinar, so if we happen to miss any, I'll be glad to email you directly. During this webinar, we'll look at the functionality of the Health Portal from the parent's perspective, review the features, and point out some of the benefits for you and for the parents. We'll start with the Health Portal standard use, then view the use of the daily parent COVID screening from the parent perspective. Then we'll review some different families and scenarios for how the Health Portal can give them the information they need and provide the information to you with the goal of getting good data without all the form chasing, telephone tag, and emailing back and forth. The goal of the Health Portal has always been and remains to save you time so that you can focus on student health. Finally, we'll look at some examples of high-level, outside-the-box practices for increasing adoption of and communications with those families you support. These best practices don't come from our engineers or a marketing firm, but from our greatest resource, our customers. Over the summer, in addition to adding the daily parent COVID screening tool, we also completed several long-term updates. A completely redesigned user interface. This includes updated colors, more intuitive graphics, and a more consistent layout. The Health Portal is now completely responsive, meaning that it will automatically adjust correctly on all devices, workstations, tablets, and phones. We also adopted WCAG 2.0 compliance standards for the portal from the parent's view. These standards make web content more accessible to those with disabilities. Finding every way we could to make communicating as easy as possible for you and your parents was the guiding principle of this update. The SNAP Health Portal gives parents access to view and update their child's school health information in real time. With a secure login and encrypted data transfer, parents can safely access their child's health information from any computer or mobile device. The health portal is completely FERPA and HIPAA compliant, and not only are we proud to be among the very first signers of the Student Privacy Pledge, we go above and beyond the pledge. Our customers' student data is never sold or shared, including in a de-identified format. So demographics, parents can review the basic demographic information that's most likely coming into SNAP from your student information system and provide feedback if updates are needed. They can provide permissions to treat and transfer. They can provide information on who should not be allowed to pick up their student. Health conditions, parents can access emergency action plans associated with conditions, as well as provide notes and update proof for review by the nurse. Vaccines, parents can review vaccinations and upload proofs, and this could be a scan, a PDF, or a photo of the document taken on their smartphone, taking the burden off of you. When a student has reached their minimum threshold on a prescription, the parent can receive a daily reminder to go to the portal to address it. Think about the time this automated process can hopefully save you, as well as opt in or out of over-the-counter medications that you have chosen to offer them. They can review the many charts and data points that you chose to share. Remember, the health portal is under nurse control. You decide what you communicate. They can review screenings, details, and upload proofs of physicals. Letters to parents, they can review and download any letters, referrals, or screenings you have sent and sign any you've requested a signature on. They can send or receive a message to or from you in real time. Download the forms you send, which they can then print up, fill out, and return on the same screen. Let's review the daily COVID screening from the parent perspective. Parents can quickly go to the health portal in the morning before school and review an announcement generated by our nurse informatics department based on CDC guidelines or one customized by you. After confirming they've reviewed, they simply answer yes or no for the overall COVID screening questions. They can enter a temperature as well. From the parent's perspective, that's it. You're getting real-time updates, have the ability to run reports and set up health trend email notifications. But for the parents, it's a straightforward two-step process after logging in. No call to or from the district to deal with, no trying to pull up a list of symptoms themselves from who knows what source, just a quick addition to the morning routine. Maybe you've been using the COVID screening tool, but haven't had time to utilize the many standard features of the health portal. Let's take a look at some case studies of parents and how the health portal can help you to better communicate with them and get better information back with less time back and forth. Ms. Diaz, as a caring, proactive mother of a type 1 diabetic, you see her son Joseph in your office almost every day and speak with Ms. Diaz almost as often. Let's see how your use of the health portal can give her access to the information she needs and perhaps give you some time spent on the phone with her back for student health. Understandably, some days at work, Ms. Diaz gets a worried feeling about Joseph's blood sugar and would often call it a check. Now with the portal, on her 2 breaks a day, she can go right to the portal and take a look at Joseph's glucose chart, showing all readings taken in SNAP, graphed over time, as well as a detailed list of all glucose readings, including those you've decided to share. With the portal, Ms. Diaz has real-time access to Joseph's vital health data. She can observe it and share it with his physician easily, which gives her peace of mind and helps support the best overall care for Joseph. Diana Williams is very busy. She has 2 kids in the district and 1 who just graduated. She lives by her schedule. You sent her a letter from SNAP about a past due immunization for her youngest, and she is sure that you are wrong. You have 3 voicemails from her, but you're both playing phone tag. With the health portal, you can send an email directing her to see for herself. It turns out her pediatrician has not updated the registry. She's able to upload a proof of vaccination that you can review and accept into SNAP. After that, you're the hero, and the pediatrician is the one getting voicemails. Norberto Daniels is busy. He's an electrician and taking care of his daughter, Isabella, a type 1 diabetic, with help from his extended family. You've had informal conversations about her depression with him, but after a referral, he wants to get it on her health record to make sure those who should know are aware. It's important to him. He's trying hard to make sure he does the right thing. By going to the health portal, Rich can go right to conditions and upload a photo of the proof from his doctor with his iPhone. While he's there, he sees the emergency action plan you have in place for Isabella's diabetes and is able to download it, print it, and put it on the refrigerator as a helpful reference for her grandmother and aunts. From yours and the portal's help, Norberto now has peace of mind that he's doing everything he can to support Isabella in school and at home. Nina Colon works at a busy call center, and she isn't able to get on the phone during school hours. She sends you an email asking some detailed questions about her son Jan's screening results. You want to help, but you have questions about her questions and need to get some clarifications. Rather than email back and forth over several days, you're able to send her a real-time message through the portal. When she's on break, she gets it and can respond right away. When you get the response, you'll be able to communicate back, ask several questions to get the clarifications you need, and then get Ms. Colon the information she needs, all in 5 minutes instead of 30 minutes over 3 days. Mr. Conrad, man of mystery. Mr. Conrad is not the only one, but he stands out. His son John seems well cared for and generally healthy, but you never hear back from his father when you share information. John's vision screening came back outside normal limits, and you sent an email but never heard back, and John still isn't wearing glasses. With the portal, you can send that referral with a request for a signature. An email goes out to the mystery dad. When he electronically signs it, you get confirmation back in SNAP that he reviewed it. You still don't hear from him, but the next time you see John, he's studying in the cafeteria with his new glasses on. Maybe the mystery isn't completely solved, but John can see his book clearly. We've reviewed the health portal for parents overall. Now I want to share some of the above and beyond steps different districts have taken to raise awareness and adoption of the portal with their parents. In sharing what other schools and districts have used successfully, we understand not all of these options will work or are available for all. That said, they may help you to communicate with your IT and administrators and spark a conversation to see what is possible to increase parental adoption of the health portal. Several districts have created videos on YouTube, which they link onto their website and other platforms. They range from the inspirational, a short 1-minute video of a group of students recorded from home, giving a straightforward message on the need to complete the form in the morning before going to school and where to log in, to more detailed step-by-step instructions provided in both English and Spanish. These videos can be linked anywhere you communicate online with your families. Here's a district that added detailed videos on many different utilities of the portal on their website. Very useful. Let's review some options for the school or district website. A link on the nurses page is always very helpful. Some have given it a prominent spot on the front page of the district website overall, where it can't be missed. While other districts have been able to allocate a special landing page that can be used for the portal or a QR code. This QR code can be listed in multiple places and allows the parents to simply pair up their smartphone to the screen and get to the logon screen quickly. Does your school or district have a strong presence on Facebook or other social media? This can be a great place to communicate about the portal with your families. Many districts use automated calling service to communicate weather and other important information. It might be worth speaking with your administration to see if this is a pathway that could be used to communicate about the health portal for parents. Maybe your district IT is very busy right now. We certainly understand that, or none of the resources we've discussed seem possible for you. It may still be worth having a conversation, but there is one thing anyone can do to get on parents' eyes on the notification about the health portal. Get a piece of paper with the link information to the portal on the family refrigerator. Maybe it can go in a mailer, or maybe you need to get it directly into the hands of the families who need to remember the portal most. If you can get some real estate on the front door of the fridge, you have them. Before I end, I just want to take a moment to thank all of the school nurses joining today. I have the opportunity to see how busy you are and taking your calls and working with you a bit. So thank you so much for taking the time to join us today. And with that, I'll turn it over to Tammy to see if we have any questions.
Sure, that was a lot of really great information, Bill. Thanks so much. And I can't help but add, I'm a parent of a child who just entered elementary school. So even now, I'm still trying to learn how information is shared in my district. And at least in my experience so far, it really tends to be a one-way street. There's a lot of information that comes at me as a parent, but if I need to reach out to the school for something, my options are pretty limited. So being able to have a conversation with the school nurse without all those barriers, I can only see as a really, huge benefit from most parents' perspectives. But it does look like we have some questions. So let's jump into those. Let's see.
Great.
The first one's from Nancy. Her question is, we've been using SNAP in my district for 10 years now. How hard is this to add to our existing system?
Great question. Thank you, Nancy. So, for customers already on our cloud, getting the portal set up typically doesn't involve your district IT unless they're acting as the admin in SNAP. There is definitely some admin setup for the nurses, but we provide, step-by-step detailed instructions on the customer portal, and a wonderful reference tool, is emailed to you when you set it up. So, of course, our technical support is always there as well, and, glad to help any way they can, if you get stuck on any step or have questions.
Great. Okay, we'll jump to the second question. Claire is asking if the SNAP Health Portal works with PowerSchool. That's a good question.
Yeah, absolutely. Well, we're very proud to be ISV partners with PowerSchool. We have been since 2011. And while, SNAP Health Center and the Health Portal as an addendum to SNAP Health Center work very well importing demographic data from any student information system, using it with PowerSchool is really nice because parents can actually log into PowerSchool and access SNAP Health Portal directly from there. So for those parents very comfortable logging into PowerSchool, it just makes that process even easier.
Okay, great. Moving on. The next question is Christine is asking about the price of the portal. Can you speak to that, Bill?
Sure. Yeah. The pricing of the portal, it's an annual cost, and it's based on student population. It starts at 50 cents per student. For larger districts, that rate is on a downward sliding scale. I'm always glad to get you, good information based on your provided student information, population. And of course, for schools and districts adding it at this time of the year, we're glad to prorate that for the remainder of the year.
Okay, great. Well, I know everyone is super busy, so we're going to stop here. I do see that there's quite a few questions that we didn't get to, but just like Bill said in the beginning, he will be addressing all those questions via email. So that will be sent out to the group. So keep your eyes peeled for that. We'll get that out shortly. And I just want to close by saying thank you so much to everyone for joining us here today. And hopefully you're leaving the webinar with a little bit more information than you came in with. And I do want to add that if you're interested in attending future professional development webinars, you can go to our website, and that address is www.promedsoftware.com. And if you go to the community section, you'll find it under the events page. That's where you can see upcoming topics, or you can sign up to receive automatic email notifications when new webinars are scheduled. So again, thank you, a big thank you for everyone joining us today. And I hope you have a great rest of your day.